Hello all, this is Dr. Fox. Let's talk about the root of the neck. In this video, we'll discuss the root of the neck and the various structures, so the neurovasculature, the muscles and bones, that comprise the root of the neck, and any classic anatomical relationships among those structures. So for starters, what is the root of the neck? The root of the neck is the inferior or proximal part of the neck that serves as a transition between the neck and the mediastinum of the thorax and these regions with the upper limbs. So when we think about the osteology of these structures, I think about the lower set of cervical vertebrae. I think about the first ribs and to a certain extent the second ribs. I think about the manubrium of the sternum, and I think about the clavicles. As we'll see, there are a number of structures which are important to the root of the neck, and we'll discuss these throughout this video. But just for starters, let's consider the structures of the carotid sheath as they descend from the neck. So we've got the common carotid artery, which is anteromedial, the internal jugular vein, which is anterolateral, the vagus nerve, which is posterior to those two elements. This has been sort of splayed out. We have the phrenic nerve as it descends. We have the anterior scalene muscle. We also have the subclavian vein and subclavian artery. And we have elements of the brachial plexus as it exits between the anterior and middle scalene muscles, as well as the posterior scalene muscle, which is behind the middle scalene muscle. So let's take a look at some of these structures in greater detail. So when I think of the root of the neck, I'm really thinking of this area here, but we get to see the communications of various neurovascular elements beyond just the root of the neck, which is very important for our understanding of anatomy. So I'll break this down by veins and nerves and arteries so that we can see how these elements relate to one another. And let's start with the veins, because through the process of learning through dissection, these are going to be some of the most anterior elements of the root of the neck and the ones that we're going to encounter first. So recall that the veins have a pretty distinct pattern. We've got internal jugular veins coming together with subclavian veins to form venous angles. Those venous angles are really the beginning of the brachiocephalic veins, which drain into the superior vena cava, which conduct blood to the right atrium of the heart. Know that the left brachiocephalic vein is longer and more oblique than the right, which is shorter and more vertical. So we can see that everything is going to be posterior to these veins. We can see that the various nerves, so both the vagus and phrenic, are going to be immediately behind these elements. So focusing on now what is behind, coming down in the carotid sheath, we are going to have the vagus nerve. And we can see here on the right side, the right vagus nerve gives off the right recurrent laryngeal nerve that wraps around the right subclavian artery on its way before ascending up to the larynx. And then it will continue, the vagus nerve will continue on down into the mediastinum and regions beyond. On the left side, that left vagus nerve descends down posterior to the brachiocephalic vein anterior to the arch of the aorta, and it would continue on its way through the mediastinum. And it's here that around the concavity of the aorta that the left current laryngeal nerve branches off and ascends back up towards the larynx and the neck. That left recurrent laryngeal nerve is oftentimes found in association with the ligamentum arteriosum. That ligamentum arteriosum is in the vicinity of the right pulmonary artery, the concavity of the aorta. Now, those vagus nerves are both somatic and parasympathetic. They have a number of targets that we've discussed elsewhere, but targets throughout the neck, thorax, and abdomen. The other nerves that we care about in the root of the neck are the phrenic nerves, and these phrenic nerves are going to be more lateral than the vagus nerves. Let's take a look at that. So the phrenic nerves enjoy very classic anatomical relationships with the anterior scalene muscles. So we can see them there and there. They descend the anterior scalene muscle in the neck. These are comprised of branches from ventral primary rami of C3, 4, and 5. So the mnemonic is C3, 4, 5 keeps the diaphragm alive. They descend down into the mediastinum, where they'll insinuate themselves between the pericardium surrounding the heart and the pleura surrounding the lungs on the way down to innervate the hemidiaphragm, so either side of the diaphragm. So phrenic nerves are driving ventilation by controlling the diaphragm. Posterior to the anterior scalene muscles and those nerves that we just discussed are the arteries. So all of these arteries are enjoying blood coming from the heart, specifically the left ventricle of the heart, which is connected to the ascending aorta, which is going to morph into the arch of the aorta and then the descending aorta before going down to serve the rest of the body. We have three branches of the arch of the aorta. We have the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. So those common carotid arteries there and there are going to ascend the neck through the carotid sheaths, and then they're going to bifurcate into the internal and external carotid arteries. The internal carotid arteries serve predominantly the cranial cavity and brain. They will exit to serve the orbit and forehead and anterior scalp with blood, whereas the external carotid arteries are going to serve the neck, the face, and the superficial head with blood. In the vicinity of the root of the neck, what we really care about are these subclavian arteries. Subclavian arteries are going to be the predominant blood flow to the upper limbs, but they also are going to have various branches to serve both the neck and thorax. So recall that the subclavian arteries have three parts, and those parts are differentiated by the anterior scalene muscle. So the first part is medial to the anterior scalene, the second part is posterior to it, and the third part is lateral to it, out to the lateral margin of rib 1, whereby they become the axillary arteries. And within that first part, we have a few major branches that we care about. There's the vertebral arteries, which supply the cranial cavity and brain with blood. There's the internal thoracic arteries, which supply the intercostal spaces with blood and some of the anterior abdominal wall, as well as the thyrocervical trunk, which serves targets in the neck, as well as the trapezius muscle and some of the rotator cuff muscles and shoulders with blood. Now that leads us to our assessment question of the video. And that is, while many anatomical structures of the root of the neck display strong bilateral symmetry, which feature has very typical bilateral asymmetry? So let's think about this. Which structure, root of the neck, is very asymmetrical? Is it A, the anterior scalene muscles? Well, they're pretty symmetrical on both sides, so no. B, the phrenic nerve? Well, we've got one on each side in association with the anterior scalene muscle, so no. C, the recurrent laryngeal nerve. This is a really good candidate because the recurrent laryngeal nerve is originated from the vagus nerves at different points. So at the root of the neck, the right recurrent laryngeal nerve originates and wraps around the right subclavian artery, whereas down in the mediastinum of the thorax, the left recurrent laryngeal nerve wraps about the arch of the aorta at the concavity of the aorta. So I like that answer. Subclavian veins, no, those are pretty symmetrical. Vagus nerves, those are pretty symmetrical as well. So the best answer here is C, recurrent laryngeal nerve. Thank you so much for your time, and I'll talk to you in the next video.